I'm in the presence of some esteemed doctors of our nation. And the journey of AIIMS also tells a lot about the journey of India. And of course, the journey began with Delhi. So I must begin my conversation with Dr. M. Srinivas, who's the director of AIIMS currently. Sir, I'd like to understand from you, like I said, it started with Delhi, and then it took many decades, many decades, till the next batch of AIIMS hospitals came up in the country. But now we're on almost a war footing, developing more and more AIIMS across India, making healthcare accessible to people across India. So I'd just like to begin by asking you your thoughts on all the new AIIMS hospitals that are being developed.
See, the mother AIIMS is at New Delhi. Way back in 1956 we started. And there's a huge load of the patients and requirement in the entire country, you know. With that, the vision, the new AIIMS were been taken over. And the few of the first of the thing, I think 6 or 8 of them have come to a very international level. The rest of the things also will fall in line, and over a period of time, whatever 21, 22 institutes we have, they will reach to the level where they will be of national and international standards, which will take care of the patient load, which is happening to the New Delhi AIIMS. And they will also excel in the areas of teaching, learning, academics, research, and the patient care, in addition to the mandate which has been for the regional areas of that particular state, you know.
At the same time, Doctor, how exactly is AIIMS now integrating with schemes such as PMJ? Because, like I said, AIIMS as a concept was, of course, all about making healthcare accessible to each and every class in India. And now we, of course, under this current government, see marvelous schemes like PMJ. How is AIIMS then integrating with that?
We are part and parcel of the national programs, whichever is happening, and the PMJ is a flagship program of our country. And the patients, whoever come with the PMJ, definitely they will have the benefit in our us. Unfortunately, the Delhi government doesn't have that scheme, so we don't have that kind of huge load, unlike other institutions in the country. But whatever the patients who are coming to us, refer to us with the PMJ scheme, we are taking care of them.
And when we talk about Jan Aushadhi scheme as well, sir, if you could just help explain to our viewers, because we've had a very educative day, what really is the AIIMS then expanding list of free medicines?
We are having that kind of Jan Aushadhi outlets in our place. In addition to that, Amrit Pharmacy is also there with us, which is a paid product. And the people who cannot afford, and in fact the people who have looking at the quality as well as affordability, and this is a place where you get the generic medicines, and they are getting it free of cost.
All right, I'm going to just quickly bring back into the conversation now Professor Dr. N.K. Arora, who's the president of AIIMS Deoghar. Sir, just your thoughts as well. I'd like to understand from you, because you've been in the field of medicine for so long. I'd just like to understand from you what is your thoughts on the expansion of AIIMS, and what really do you feel needs to be the vision of our nation as far as AIIMS as an institution is concerned?
In fact, even if you have not called me, I would have raised my hand for this question. AIIMS is to be considered as a philosophy, as a new approach towards clinical care, teaching and research. It is creating an ecosystem where the best in these three areas comes out. And that is what AIIMS New Delhi is. I am an alumni of AIIMS New Delhi. I was part of the 16th batch. And what has come up, and this is what is to be translated, that the ecosystem in each of the AIIMS is such that it provides a independent thought process which encourages clinical care, teaching new innovations in that, and also doing research which is relevant to the national needs. Here I must tell you that in this whole country, Anupam Sibbal in the previous session was saying something very important. Now we have super specialization very well embedded into our health system. But most of these courses and training programs were originated at AIIMS New Delhi, and that is what is the purpose of New AIIMS is. Second point, that New AIIMS is to provide regional leadership in problems which are very regional. So for example, tribal health. For example, metabolic disorders. If there is AIIMS Guwahati and we need to understand unique issues related to Northeast. For example, cancers are very high. So we need to do research which is very much focused on that, which brings into light new dimensions into that, whether it is clinical care and teaching. And finally, one very important component in all New AIIMS is integration of modern medicine with traditional medicine. Every New AIIMS has a whole division of traditional medicine. And this needs to be kind of one. And finally, one more point, and that is, I think AIIMS is also contributing how to develop models of care. We cannot provide care to 1.4 billion. We can provide models of care which rest of the 700, 800 medical colleges follow up. And for that, whether it is HRH, health system related manpower, or systems research, all that is part of what is AIIMS is. So AIIMS is not to be seen as a new building or a new hospital, but as a philosophy and an ecosystem.
Very interesting. So, Dr. N.K. Arora, I'd just like to continue. You've spoken about traditional medicine. If you could just elaborate on that a little bit, because we have for very long been fighting a global misconception about traditional medicine, about Ayurveda. We fought a very long battle with European and Western countries refusing to recognize the power of our ancient medicine. But how exactly is it that it's being integrated via AIIMS now?
So, I think we have to take this whole issue in a stepwise manner. And I will give you an example of AIIMS Deoghar, which is kind of a baby AIIMS, which is coming up. Students are already there, undergraduate, postgraduate. So a National Center of Excellence for Tribal Health has come up. Now here, a very systematic study of tribal medicine is being done. We have our traditional knowledge of Ayurveda, Siddha and Unani, those medicine is there, and then traditional medicine. So students, the postgraduates as well as the faculty are encouraged how for many of the disorders, the two systems can be brought together in either in tandem or as complementary to each other, so that the best is available for our patients. And the whole philosophy is also, we heard that health system has to be very close to your house. Yes. And that is what is the meaning of all our traditional medicine, that it has to be available at home. Tomorrow you have a problem, you would like the doctor to come and see you at home. So same philosophy with these new health and wellness centers is that health system reaches right at the doorstep. And how we can integrate, because it is here that if we have to have accessible and affordable and quality care, this bringing them together, integration is absolutely critical, and we have to move together. And as we know that in 2047 we want to say that we are the best health system, and which is to be copied by the rest of the world. And I think we have started moving, and AIIMS is taking a leadership in that.
Yes, sir.
जो प्रोफेसर अरोड़ा ने अभी बोला, मैं उसी की कंटिन्यूटी में आपसे ये कहना चाहता हूँ कि वन ऑफ द मैंडेट ऑफ एनी एम is to produce the evidence. If you are integrating the modern with the traditional, and what you said that there are many myths in the community, doctor community, in the general public, then the cause of these misconception is because we were not having any evidences. So we are as AIIMS are there to produce the evidences, to make it scientific, to produce it in front of whole world, that these are not just jari booty, but they are really scientifically proven medical elements.
Absolutely. At the same time, Dr. Ajay Singh, I'd continue the conversation with you. You're the Executive Director of AIIMS Bopal. And that was one of, like I said, after New Delhi, Bhopal was one of the first batches to come up of AIIMS. But how exactly is there some sort of an assistance or some sort of a model that has been developed by, say, an AIIMS New Delhi or AIIMS Bopal, which is then being forwarded to some of the other AIIMS that are coming up in terms of administration, in terms of management, in terms of the quality of doctors that is required?
देखिए बेसिकली कोई भी एम्स जो जितने भी नए बन रहे हैं सब ऑटोनॉमस हैं, सब रीजनल इम्बैलेंस को कंप्लीट करने के लिए, एड्रेस करने के लिए उनको बनाया गया है. तो किसी को भी इक्वेट नहीं करना चाहिए, किसी को भी कॉपी नहीं करना चाहिए. ये मुझे बेसिक फिलॉसफी मुझे ऐसा लगता है एम्स बनाने की नहीं थी कि हम लोग एक ही चीज़ को रेप्लिकेट करते जाएं और बहुत सारे सेम सेंटर बना दें. हमको वन ऑफ द थिंग विच वी शुड एड्रेस इज द लोकल नीड, द रीजनल नीड विच फॉर विच पेशेंट हैज़ टू गो टू दिल्ली, दैट शुड हैज़ टू बी रिड्यूस नाउ. तो उसके लिए हम लोगों को कॉपी करने की आवश्यकता नहीं है. हमें अपने रीजनल जो रिसोर्सेज हैं, जो हमारी प्रॉब्लम्स हैं, उनको हमें रिकॉग्नाइज करना है, उनकी एक रजिस्ट्री बनानी है, उस पे हम लोगों को एविडेंसेस क्रिएट करना है, तभी हम लोग आगे बढ़ पाएंगे. अदरवाइज़ यदि सभी लोग एक ही तरीके का काम करेंगे तो कहीं ना कहीं मुझे ऐसा लगता है कि हम लोग पीछे रह जाएंगे. और एक कंसेप्ट जो मुझे लगता है कि एम्स को जो गवर्नमेंट ऑफ इंडिया ने बनाया है, वन स्टेट वन हेल्थ पॉलिसी, जी, एक ऐसी एसओपीज़ बनाने के लिए जिसको डॉक्टर श्रीनिवास ने भी बोला कि एक ऐसी पॉलिसीज़ बनाने के लिए जो यूनिफॉर्मली हम लोग ट्रांसलेट कर सकें पेरिफेरी लेवल पे. जो पेशेंट हमारे तक आने में यदि 2 दिन 3 दिन का समय लगता है और उसके पास एसओपीज़ हैं, तो उस डिले का कोई नुकसान पेशेंट को नहीं होगा. तो दिस इज़ आई फील वन ऑफ द मोस्ट इम्पॉर्टेंट पॉलिसी and the mandate of any of new AIM.
So, Professor Ajay Singh, is there then, as you said, you want to now focus more and more on evidence, has the burden on, say, an AIIMS Delhi or some of the other older AIIMS, has that reduced with the number of AIIMS that are growing up, or do we still feel that maybe some of the newer branches still lack in some areas in terms of maybe equipment, facility, expertise, knowledge, that they're not being able to treat, as you said, the bigger diseases that people were coming to an AIIMS New Delhi for?
As far as the burden of the patients concerned to the AIIMS Delhi, so I feel that the burden may not be as much as we thought of.
Okay.
Because it is not because we don't have the equipment, it is not because we don't have the skill, we don't have, I mean, it is not because we don't have the skilled doctors there. It is the brand name of the AIIMS Delhi that is there for so many years. So slowly we are working on that, and slowly we will try to build our own brand, and only then the patient will stick to us.
And maybe someday people from Delhi might opt to go elsewhere for a treatment as well.
Yeah, it is started happening now.
That is possible. So, and hopefully the message also reaches out to people that, you know, it's not just AIIMS Delhi that exists. There are more and more, multiple AIIMS. In fact, we'll soon hit a mark of 25. But Professor Arora wanted to come in there.
So, I must say that although it looks like on the face of it, it looks very straight, that new AIIMS will decrease the pressure on the original AIIMS.
Yes.
But I don't think that is correct. As I understand, the AIIMS New Delhi still gets about 12 to 15,000 patients a day. It is world's largest outpatient hospital with about 50,000 footfall. Now, that is kind of a saturation point. But I think COVID, if you go back to the COVID, wherever AIIMS was operational, it attracted maximum number of patients from the highest strata of society to the lowest strata. Now that just indicates that there is now more democratization and decentralization of healthcare. The quality of healthcare available across the country is also improved, both in public sector as well as private sector. So to say that the number of patients will decrease in AIIMS New Delhi? No. Actually, in most of the new AIIMS, I'm sure Ajay will tell us, about 5,000 to 7,000 patients come at AIIMS Bopal, at new AIIMS like Deoghar, about 2,500 patients come every day. So this is, that is not the purpose. As I said, AIIMS is to provide models of care so that everybody else follows.
Right. Absolutely. Dr. Ashok Puranik, let me bring you into the conversation, sir. Executive Director of AIIMS Guwahati, also with us, one of the newer AIIMS once again. I'd like to just understand from you, sir, then what do you perceive are the challenges in terms of setting up an institution like AIIMS, which already has a reputation?
Okay, thank you for giving me the opportunity. You see, setting up an AIIMS, which is a tertiary center where we require to develop a center gradually from offering basic medical education to graduation, then the internship, then the postgraduates, then the making the super specialist doctors. And tertiary care like interventional radiology, cardiology, advanced cancer care, the organ transplant and all that thing, it's gradually aided. I can tell you with my experience that it takes almost 10 years to establish a well-functioning, well-anointed AIIMS. Minimum a decade is required. My institute is just 8 months old.
Yes.
It was inaugurated by Honorable Prime Minister on 14th of April last year. And since the day when we started getting a huge number of patients, like Dr. Arora said, just like Devghar, we also get around 2,000 to 3,000 patients a day in the OPD. Where we make the difference, like last 30-40 years when the yellow fever vaccination was introduced, anybody visiting to the Africa or anybody visiting to the South American country, people were coming to Delhi or going to the Calcutta for the yellow fever vaccination.
Yes.
But we immediately started the yellow fever vaccination. So that makes the difference, you know, the amount of our reach, our commitments, you know. So your first question to Dr. Srinivas was about what do you do and how the things got
Yes.
established. The whole intention was to provide a kind of a super specialist care in the research. That was the original model when Amrit Pal Kaur, Rajkumari Amrit Kaur was the very instrumental in setting
Yes.
up the AIIMS Delhi. Similarly, I must say that it was the conviction of our Prime Minister that he saw the regional imbalances and he thought that Northeast shouldn't be left alone. And now we see the vision. We have already introduced PG courses this year, and we have the state-of-art MRI and all the advanced digital subtraction and geography and all that thing. So gradually I'll be adding and we'll be doing everything what is being done at Delhi. People who were going to the Mumbai, Calcutta and Delhi for the treatment will get the treatment at their doorstep. That's a
Right.
big achievement. Which is going to happen very soon.
And Dr. Puranik, I'd just like to also ask you, sir, what then do you perhaps focus on in terms of building confidence in the institution when, you know, regional, as you said, in order to tackle regional imbalances, but there has to be some confidence building that has to be done?
Okay, so like when any director is chosen or any faculties or the teaching staff or the technical staff is chosen by that director, that makes a huge difference. I think we know that we are given autonomy for that sake that you are going to make a pristine doctors, you are going to do a kind of a cutting edge research, you are going to practice a precision medicine, you are going to be a kind of a modern person with the modernity, and you'll be following what's happening all around the world, you know. So we are not lagging, we shouldn't be lagging behind in any field, especially in today's time in the era of internet. We practice protocol-driven care. So I think there is a huge responsibility on us to
Right.
deliver all these on these three fields. And we are collaborating with IITs now for the newer things coming like use of AI into the medicine, innovating the newer products, then inventing new drugs. We have already collaboration with those National Institute of Pharmacological Research. So
Right.
we do we have got a huge responsibility of medical education, clinical care, and the research.
All right. I also have Dr. Y.K. Gupta, who's also joining us. virtually. He is right behind us, sir. Thank you so much for taking our time to speak to us. He's president of AIIMS Jammu. I'd like to begin by asking you, sir, what is the readiness of AIIMS Jammu? When can we expect the inauguration now? Dr. Y.K. Gupta joining us from Jammu, and I hope that he can hear us in this age of technology. Dr. Y.K. Gupta, I'd just like to understand from you, sir, the readiness of AIIMS Jammu, which has, of course, it's underway, the progress is underway. So when exactly, sir, can we then expect the inauguration as far as AIIMS Jammu is concerned?
All India Institute of Medical Sciences, Jammu is almost ready. 90% is in the preparedness. And the infrastructure, the building has been completed, 90%. The faculty appointment have been done. 85 faculty have joined in different disciplines. We have now 42 senior residents in place. We have already appointed 500 strong nursing team, and these nursing team have been trained at All India Institute of Medical Sciences, Delhi, in all the disciplines: critical medicine, surgery, neurosurgery, cardiac surgery, and all technical skills. And we have the staff in the readiness. The equipments are procured. Some of the equipments are under process of installation. We expect that we should be functional by end of February, and in the first phase, we would start the OPD services and the allied services like investigations and minor operations. And within next 1 or 2 months, we hope that we will commission the entire hospitals. The phase 1, we expect to commission nearly 200 beds, and maybe in next 3-4 months, we will go in a full swing. So I would say we have geared up in a mission mode, and my thanks to my director, Dr. Shakti, and Deputy Director Administration, Mr. the Colonel, our team, and all the members who have worked day and night to make it successful and make the vision of our Minister, Honorable Prime Minister, a success story.
Okay, Dr. Gupta, how is the recruitment process for AIIMS Jammu going, sir?
The recruitment process of AIIMS Jammu, or the aim and objective is that we get the best of faculty member from across the globe. The advertisement, 2-3 times the advertisement was floated, and we had a 2 principle of selection of the faculty members. The faculty members should be pan-India, including if we get the best of the faculty members from the globe, we will take him. Number 2, that the quality cannot be compromised, even if we are remaining short. Fortunately, we are fortunate that our selection committee was able to get the very, very eminent faculty members from nearly 17 states. The geographical distribution of the faculty members is from 17 states. And we have already floated the interview on rolling basis, and we expect that as and when we get the best faculty members from remaining posts, we will fill them. So, all right. And importantly, the issue is that we have sent our faculty members for 15 days to 3 months training, depending on the need and the availability of slots, to our mentor institute, All India Institute of Medical Sciences, Delhi, for training and for acquaintance of working at the same pattern at All India Institute of Medical Sciences, Delhi, in Jammu.
All right, Dr. Y.K. Gupta, thank you so much, sir, for joining us on Medically Speaking, the Sushruta Awards this year, amongst of course, all our other esteemed doctors from AIIMS who are also with us. But I'd like to just come back to Professor Dr. N.K. Arora. So you'd raised a point of, how there is an increased incidence of cancer cases, you said, in a specific community. If you could just elaborate on that, and how exactly was that even found out?
So, in fact, I must say that for biomedical sciences, a lot of investment has been done for last 2 to 3 decades. And that's the reason that in last 4 years, now we have got vaccines platforms, 6 or 7 platforms, and I think we are at the cutting edge of science, and probably the only country or one of the 2 countries or 3 countries which has such a kind of a varied R&D infrastructure. Now, secondly, all over the country, registries have been established. There are, I think, over 100 registries, some population-based, the other hospital-based. And these are being coordinated by Indian Council of Medical Research. And that has consistently shown that in several of the northeastern states, the incidence or risk of cancer is highest. I'll give you some. Recently, we have been hearing a lot about HPV and cervical cancer, and there was a lot of this story going around in last couple of weeks. And the highest incidence of cervical cancer is in Meghalaya.
Okay.
Similarly, very high incidence of nasopharyngeal cancers are there. Now, with coming of AIIMS at Guwahati and then establishing, there is another national institute called NIGRIMS in Shillong, and regional centers of cancer and a series of centers have come up. So it will not only provide clinical care, it will also do highest quality research and training, so that part of our country. So very regional issues, but it has global national relevance also, because cervical cancer occurs in the rest of the country. But we will have very important lessons from that part of our country.
Dr. Puranik, I think you wanted to add to that, sir.
Yeah, exactly. I think we need a behavioral change in the society. Then only we can control it. People smoke, people drink, people have a smoked fish. The nutrition is poor. There is an environmental degradation and the poisonings. So there is multifactorial things. Then there is another genetic factors also that we can. That's a part of research. But all said and done, the smoking is very, very prevalent even among the young adults, especially the tobacco consumption along with the betel nuts, which is a rotten one. They got a special method of making those preparations. So there is a direct connection with their habits, and that habits die hard. So we really need a kind of drastic change in the society. We need to really interfere it. We need to target those people right from the beginning to the adolescents, and we need to really discourage smoking, drinking, and betel chewing, and smoking, and then the tobacco chewing. All combination. This is the cause of oropharyngeal cancer in the whole Northeast. If you go to the Tata Cancer Hospital in Mumbai, you will find most of the patients coming from the Northeast. So we are developing a center. Even the Tata has got a collaboration with the state now, and almost more than 30 centers are coming up along with the Tata collaboration, so that people can be detected early, they can be treated early, at the same time they can be screened, and at the same time preventive strategies can be applied.
Yes, Professor Ajay Singh, you wanted to add to that, and I'd just like to also understand from you, sir, on that note, whose responsibility then it becomes to also maybe nudge some sort of a societal change, because the hospital gathers the data on this. You understand that in the Northeast it's because of certain behaviors that could possibly be resulting in a large number of cancer cases, which is entirely preventable if you weren't engaging in those behaviors. So when that data is shared, does that then become the responsibility of a government or of society, of the media, to then highlight it further and ensure that preventable cancers are not occurring?
Before to your question, I would continue to say that one of the mandate of any of the AIIMS or any of the hospital is to go outside the campus of that hospital to work in the society itself. That is the outreach. If you are reaching out you are communicating with the population, the general public, then many myths you will understand, and you will be able to convince those what are the bad habits you can prevent. So we have to go out from our hospital. We are not meant only to treat the patient, but also to prevent it. And this preventive aspect of the medicine should be one of the mandate of our AIIMS. So you are saying that whose responsibility is this? This is a teamwork. It is not a responsibility of one institution, one individual, whether government. It's a combined one. So, but before going into any policy decision, we have to recognize the burden of that disease, and unless until we will not be able to identify the burden, we will not be able to know what is the significance and what are the steps we have to take to prevent or to treat or to decrease it. So it is a responsibility of everyone, including the media, to spread the information, the correct practices. The media, what event you are holding today, we are able to communicate so many persons directly, indirectly, and we are able to tell them what should not be done and what should be done. So this is the combined responsibility.
Okay, Dr. M. Srinivas, I'd like to bring you back into the conversation. I'd just like to understand your perspective on that, sir, because just the sheer number of patients that come in and out of AIIMS Delhi, and someone had shared an anecdote with me that Indian doctors are in fact some of the best in the world because of the number of patients and the number of bodies and people that they're able to work on. So they're able to gather a vast set of expertise in a very short amount of time because of the sheer number of people you're operating on a daily basis. What are your thoughts on that, sir? And how does AIIMS New Delhi then take that forward in terms of dealing with some preventable diseases?
That's absolutely true, because at the end of the day, if I'm a surgeon, it depends upon what kind of cases I've seen, what kind of spectrum of the cases I've seen, what kind of complex conditions I've seen, and what kind of complicated cases done elsewhere which have failed and come back to AIIMS New Delhi, and we have managed. All this is a lot of learning for all of us as a resident and the trainee. And I think it's a gold mine. If you ask me, the All India Medical Sciences is the mother AIIMS, and is definitely continue to be mother AIIMS, and this kind of exposure is not going to happen in any center in this country. So if you look into the complex cases and all the teaching which happens, and these are the people who are going to be trained in this institution who will run the other institutions. If you look into the mandate of the AIIMS, we are supposed to make the teachers who will teach elsewhere and bring those institutions of national importance. This is the mandate given to us in the mother AIIMS. So that's what we are doing it, and the people who are manning are also from the All India Institute of Medical Sciences. If you look into the best of the people in this country, most of them are from the mother AIIMS. So I think that's a good opportunity for all of us, and then over a period of time, other AIIMS also will become the same things. The other institutions also will have a huge numbers which will take care of the regional needs of that particular patient, and the spectrum will increase, and they will have the similar experience over a period of time. So it took 40-50 years to come to this level for us, and they are just 10-20 years.
Absolutely, and of course, as a country, we wish the very best for AIIMS. Thank you so much to all our doctors for joining us today. And as sir said, that it will take some time, but it's only because, and during COVID is a time when a lot of us realize the importance of other AIIMS centers. I'm from Delhi, and my father-in-law was in fact saved in AIIMS Jhajjar. That's where he found a bed. So cheers to all our doctors who are with us today. It is their hard work, day in and day out, that results in India being a healthier nation. Thank you so much. Once again, to Dr. Professor Ajay Singh, Dr. Y.K. Gupta, Professor Dr. N.K. Arora, Dr. M. Srinivas, and Dr. Ashok Puranik for joining us at the Sushruta Awards 2024. Thank you.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.